Thank you for joining us on Health Matters. I'm Dr. Mark Castellaw. Our show today is about the heart. We're having different heart specialists come talk to us about procedures and signs and symptoms that we need to know about. But more importantly, we're going to have some patients here that actually experienced heart disease. Our first guest today is Mr. Jim Sykes. Mr. Jim Sykes is a disc jockey for Elvis Radio on Sirius XM.
That's right.
Welcome, Jim.
Thank you. Appreciate you asking me.
And Jim is also, he shares a Friday afternoon program with a Memphis icon, George Klein, who has a program on this TV station called Memphis Sounds. Be sure and check that out. Well, Jim, tell me about the day that you walked into my office.
Well, I've been suffering from some symptoms. I didn't know what was going on really for about a week and a half. And I told George at the radio station, I said, George, I'm just not feeling well. He said, go see my doctor. He's got an Elvis waiting room. So I did. I came to see you.
Now, not everybody knows that, but at our office we have an Elvis room, a special Elvis room. He was our patient there and everything, but that's what he's talking about.
And it was a quick visit with the nurses. They said, what's wrong? I told them I didn't feel good. I had some pain in my arm. I had some night sweats. I started vomiting, and I was really having some pressure in my chest. And they immediately put on I guess it's the EKG. Is that what that is? And within moments, you came into the room and said, Jim, lay back, put this pill under your tongue, you're having a heart attack. And that was the first time I'd met you. And you called the ambulance. They took me into the hospital, and that morning they did triple bypass surgery and saved my life.
Wow, wow, what an incredible story. Not oftentimes does a patient come in the process of having an acute MI, but Jim was, and Jim was so fortunate that things turned out like they did. But tell us a little bit more about the symptoms that you were having prior to this, Jim.
Well, I had actually forgotten some of the symptoms, so I asked my wife. She was very, very angry at me because I wouldn't go see the doctor. And I remember her screaming at me, you've got to go see the doctor. And so I finally did.
Men do what your wife tells you to do. That's so important. All right, go ahead.
But when I finally did go see the doctor, it was almost one of those textbook cases that I've continued to read about over the last 18 months since the surgery. It's one of those things where I just didn't know what was going on, and if I'd have gotten to the doctor earlier, I might have actually not had to have gone through the surgery. And so I want to make sure to advise everybody, please go see your doctor, go to the emergency room at the first sign, and those signs are so easy for folks to remember. It's chest pain, problems with maybe your arm, or like I was suffering, I threw up several times, and there were just a number of signs that I should have known.
At one point you were thinking you were just having some shoulder pain.
I thought it was my old trapezius muscle injury from being a kid, you know, and it was circulating down my arm, and then you hear these phrases now, and I think, well, I should have known. And it's just that masculine thing, you don't want to go see the doctor. But please go see the doctor, and don't go through what I went through. It's not an easy thing to get through the triple bypass surgery. There were weeks there where I just didn't know if I'd ever be the same. But now I'm much better. Stop smoking. That's the most important thing.
Most important.
I was smoking 3 packs a day, and I don't smoke at all anymore. It's been 18 months. My lungs, I feel so much younger and so much more vibrant. I have so much more energy. You also have to eat right. You taught me how to eat right. I came back to you weeks after the surgery, and you began to tell me what I needed to do, and then you told me I had diabetes, which made a radical change in what I eat. I had to drop all the sugars and all the colas. But really the most important thing, I think, is the exercise. You've got to get exercise. And for 49 years, I didn't exercise at all. I didn't get up out of my chair. I just talked on the radio, so I sat there behind the microphone. But now I'm exercising, and I really feel great afterwards. That's the thing, is once you start that exercise program, you're going to feel better, and that's the whole point.
Well, Jim is a poster child for what you should do after having the bypass. He has done so well and has been so compliant. But take us back to you getting the heart cath, and then you're being told that you have to have a bypass. What was that experience like going through the surgery? Do you recall much?
Absolutely. It was the scariest moment of my life. You know, as they wheeled me into the emergency room, I held hands with my wife, and I shook hands with a couple of my friends that were there waiting on me as the ambulance pulled in, and I thought, this is it. This is how I'm going to die, right here today in the next few minutes. And they took great care of me. They explained to me what was going on and what they were going to have to do. and there were 9 holes put in my body that day. A large opening in the middle of my chest, and then 8 other places where they have to cut into you to make you better. They took a vessel, I guess it's a vessel, blood vessel, out of my leg and put it in my heart, and made me a bionic creature of sorts. It's been a traumatic thing, but it's also, not only was it the worst thing that ever happened to me, it's become the best thing that ever happened to me. My brother had these same symptoms and the same surgery 10 years earlier. Now, I'm desperately trying to get him to quit smoking and to eat better, but our father died at age 51 from this disease and had a heart attack and was gone, and I miss him every day. And I want folks that are suffering or think they may be suffering from these kinds of problems, get yourself checked. Get your heart disease problem fixed. It can be fixed.
Well, some of the best advocates for heart disease prevention and screening are people that have gone through that. And so that's why I wanted Jim to come on our show today and share his experience with us. And today you feel great.
I feel so much better, so much better. We went to the zoo not too long ago with my youngest son and my oldest son and our grandchild, and they all got tired before I did. And I thought, this is amazing. It's an amazing transition that I've been able to make. Thanks to you, Dr. Gooch, and all the great folks at Baptist. It's just been one of the biggest blessings any man could ever have, and I thank you so much.
Well, Jim, it's a pleasure taking care of people like you, and I know you're so grateful. And again, the emphasis is, just as Jim said, early intervention. Don't be macho man and try to ignore symptoms. If you have problems, oftentimes, as Jim said, you can get to it early where you don't have to have bypass. Don't let the idea that everyone's going to have bypass surgery, because they're not. But if you get to your doctor early enough, things can be done to prevent that. And our next patient that we're going to talk about that, something that you can do for heart disease other than a bypass. This is Dr. Mark Castellaw with Health Matters.